Preparing a daily or weekly schedule. In most offices, as medical assistant, you are responsible for preparing a daily and weekly schedule of appointments. Make a copy for the providers and other office staff members. When there are changes in the schedule, ensure that corrections are made on all copies. Place the next day's schedule on the physician's desk before he or she leaves for the day. Give the next week's schedule to the physician before he or she leaves on Friday's schedules. Should include not only patients. Give the next week's schedule to the physician before he or she leaves on Friday. Schedule should include not only patients' appointments but also hospital rounds, surgeries, meetings, and any personal engagements on the schedule. Computer systems print a daily or weekly schedule, but you must remember to make changes manually as the day progresses. Patient reminders. Offices use various kinds of reminders to tell a patient about an appointment that should be made or to remind them that an appointment has been made on a specific date and time. These reminders are the appointment card, the telephone call, and the mail card. Appointment cards. An appointment card is given to the patient when he or she leaves the office. It should have the following information, and those are patient's name, day, date, and time of the return visit, physician's name, and telephone number. If the patient requires a series of appointments, try to make them on the same day of the week and the same time of day. This will make it easier for the patient to remember the appointments. Unless your appointment card allows you to list the complete series of appointments. However, give the patient a card for the next appointment only and repeat this procedure after each subsequent visit. When the patient has to save several cards, they can easily be lost or cause confusion. If using a manual system, write on the card with ink so that it cannot be altered. Computer appointment scheduling software provides appointment cards that can be printed on special perforated paper. Telephone reminders. All new patients and patients with appointments scheduled in advance should receive a telephone reminder the day before their appointment. Computer systems can place the call to the program number and remind the patient of the appointment with a pre-recorded message. Remember, do not call a patient at work or leave. Part 2. The Administrative Medical Assistant. A message, unless you have been given permission to do so. Make the telephone reminder simple. Identify your office and yourself and state on the date and time of the appointment. For example, you might say, "This is Mrs. Sprinkle from the Dr. York's office. I'm calling to confirm your appointment for tomorrow, Thursday, February 10 at 3:30 p.m. Unless the patient has a question, then say thank you and goodbye." This reminder helps jog the patient's memory, and if the patient must cancel or reschedule an appointment, you will have time to fill the slot. Keep a list that the names and phone numbers of patients who have asked to be called or who need to be seen sooner than their next appointment. This list may be called a cancellation list, a waiting list, or a move up list. Make a notation on the appointment schedule, such as confirmed, left message, or no answer. Mailed reminder cards. Some offices send reminder cards instead of making phone calls. Reminder cards are also used to remind patients who could not be reached by phone that it is time to keep an upcoming scheduled appointment. This should be made at least a week before the date of the appointment. In addition, reminder cards are sent after a set period since a patient's last appointment. Reminder cards are often used to alert patients to the need of annual examinations. Mammograms. To handle this kind of reminder, keep a supply of pre-printed postcards in the office. The card should have a simple one or two sentence message such as, according to our records, you are due for your annual physical. If you would kindly call the office, we will be glad to arrange an appointment for you. The physician's name, address, and telephone number should be printed on the card. Place the card in a tickler file and mail it at the appropriate. Emergencies. When a patient calls with an emergency, your first responsibility is to determine whether the problem can be threatened in the office. The office should have a policy for evaluation of the situation. The word "stat" is used in the medical field to indicate that something should be done immediately. You also should have a list of appropriate questions to ask the patient, such as, are you having chest pain? Are you having difficulty breathing? How long have you had the symptoms? When several symptoms occur together, they may indicate a particular problem. This group of complaints is referred to as a constellation of symptoms. One group of symptoms found to indicate a certain disorder is severe right lower quadrant pain, nausea, and fever. A physician who sees this constellation of symptoms considers appendicitis. Patients who are acutely Patients who are acutely ill often have serious, although not life-threatening conditions. These patients need to be seen as soon as possible, but not necessarily on that same day. Obtain as much information about the patient's medical problem as you can, so your message to the physician will allow him or her to decide how soon the patient should be seen. Place the chart with a note in the location selected by the physician and tell the patient you will call back as soon as the physician makes a decision. Walk-in patient. Walk-in patients are those who arrive at the office without a scheduled appointment and expect to see the physician that day. In general, you must first determine the reason for the walk-in. Late patients. Patients who are late cause problems in the schedule. You should gently but firmly apologize for any delay, but tell the patient you were late and Dr. Wotton is seeing another patient now. Part 2. The Administrative Medical Assistant. To see you in about 15 minutes. Patients who are routinely late should be politely advised that according to our office policy, patients who are more than 15 minutes late will have to be rescheduled. Physician delays. If office hours have not yet begun, call patients with appointments scheduled early and give them the option of coming in later in the day or rescheduling the appointment for another day. If patients are waiting in the office, inform them immediately if the physician will be delayed. Missed appointments. A missed appointment or no-show occurs when a patient neglects to keep an appointment and does not notify the office. When this happens, call the patient to try to determine why the appointment was missed and to reschedule for another time. Cancellations. Patients who must be rescheduled need not to be told the specific reason for the physician's absence. These cancellations should be noted in the patient's medical record.